The UK is among the few lucky ones. Worldwide, the pandemic curve has touched a new global peak. For more than a week now, the global average for new cases has been above 800,000 cases per day. It's true that India is driving the surge, but the entire developing world is struggling. The other global hotspot is Brazil. More than 400,000 people have died there. Out of these, 100,000 people died in just the last 37 days. Between the months of March and April, in fact, in those days, 37 days. Last week, Turkey entered its first national lockdown. It has the highest infection rate in Europe now. Iran is reporting its highest ever numbers. In the last 7 days, close to 20,000 new cases have been reported every day on average. And the average death rate is well over 400. Do you know who's the biggest victim of this global surge, though? Children. And I know what you're thinking. Children are not the most susceptible category. Their infections are mild. Their death rate is extremely low. So how are they the worst hit? Because this pandemic is putting them at risk of other deadly but preventable diseases. Here's the latest assessment from the WHO. 60 immunization campaigns have been postponed in 50 countries. 25 of these countries are from Africa. People are missing out on important vaccinations. For diseases like measles, yellow fever, polio, 228 million people are at risk, and most of these are children. They need all the vaccines for all of these diseases, also for the Wuhan virus, because kids may not be at risk of a severe infection right now, but remember the virus is mutating. Also, they can still catch the infection and become carriers of the disease, infect their friends and families, which is why we need a universal vaccination program for children. And we might consider clubbing this short with the rest of the doses. But do we have a Wuhan virus vaccine for children? It's on its way, we are told. Vaccine makers have been filing for approvals around the world. They're not making different vaccines, but trials are underway to understand if existing vaccines can work on children. And how do they work on children? In late March, Pfizer began a trial to test its vaccines on kids between the ages of 6 months to 11 years. Pfizer has filed a request with the European drug regulator for older children. It wants the existing permissions to be extended to include 12 to 15-year-olds. A similar request has been filed before the American regulator as well. Israel is closely watching these assessments because it plans to open vaccinations for adolescents. So if the American regulator thinks that the Pfizer shot is safe for children, then it's safe for Israel too, so the government says. Moderna too is conducting 2 trials. They're happening in the United States and Canada. The first one is on children between 12 and 17. 3,000 children are part of this trial. The second trial began recently, where children under 12 and babies as young as 6 months will be given a shot, just like the adults. The kids in these trials will be given 2 doses, but those below 12 years of age will be given reduced quantities of the vaccine. Then we have Johnson & Johnson. It has started similar trials. The age group is 12 to 17. Participants are being enrolled in Spain and the United Kingdom. The vaccine maker plans to extend this trial to the US, the Netherlands, Canada, Brazil and Argentina. AstraZeneca started its own trial in the United Kingdom earlier this year. But last month, the trial was halted after cases of rare blood clots emerged. India does not figure in any of these lists, as you can see. It's the developed world that gets the first mover's advantage, also the first dibs. But India recently eased the rules to approve vaccines. New Delhi will green light a shot if it is approved by regulators in American, European, British, Japanese or WHO parameters. So it doesn't need to conduct separate trials for children, the so-called bridging trials. But it needs to plan how it's going to get more doses once they're approved. Already, India's vaccination campaign is struggling. All adults can now take the shots. But even before the drive began, 20 states declared they do not have enough doses for everyone. The result is this: India's vaccination drive is still moving at a snail's pace. Inoculation for all adults began on Saturday, the 1st of May. Do you know how many citizens between 18 to 44 actually got a shot? About 86,000, that's it, in a country of 1.3 billion. At this rate, kids may have to wait for many months to get a shot in India, and India cannot afford that. Already, the surge has sparked fears of a third wave. The Health Minister of Maharashtra is anticipating one as early as July or August. Maharashtra is India's biggest hotspot. It's one of the worst affected states, and whenever cases have spiked in this state, the virus has somehow managed to make its way to other states as well. It's one of the most connected as well. The first wave hit the most vulnerable. The second wave is impacting the youth. Will the third wave hit children? India must protect its children from the Wuhan virus. Start planning inoculations for kids now and do not ignore the risk. WION is now available in your country. Download the app now and get all the news on the move.